Okay, let's unpack this. We've got a fascinating source in front of us, excerpts from a veterinary guide.
Right.
And our mission in this deep dive is to really pull out the key info on Polycythemia Vera, especially in, older dogs and cats.
Yeah, PV for short sometimes.
Right, PV. And the core issue basically is blood getting way too thick, too many red blood cells.
Exactly. And the source makes a key distinction. It calls it a myeloproliferative disorder.
Okay, what does that mean exactly?
Well, it's in the same group as some leukemias, actually. It means there's an absolute increase in the red cell mass. It's not just a relative thing.
Ah, okay, so the total number going up.
Precisely. And that's what leads directly to the high viscosity of the thick blood we mentioned.
And the source mentions the signs often sort of creep up on you.
That's a really important point. It can be very gradual.
So gradual, it might even be picked up incidentally, like during a routine vet visit.
Absolutely. Not necessarily because the owner noticed something dramatic right away.
Okay. But when signs do show up, what are we looking for?
Yeah.
The source listed a few common things.
Yeah, things stemming from that poor oxygen flow due to the thick blood. General stuff like depression, maybe seeming a bit off.
Right. Anorexia, weakness too.
Yes, and interestingly, increased thirst and urination, polydipsia and polyuria.
And you might actually see something, like redness.
You know, redness of the skin, gums, mucous membranes, what vets call erythema, that's mentioned.
And then there were some more striking signs mentioned, especially with the eyes.
Yes, this is where that poor blood flow can get really serious. The source talks about dilated, twisty-looking retinal blood vessels.
Wow, you could see that in an exam.
An ophthalmic exam, yes. It can also cause inflammation inside the eye, uveitis, and even, well, acute blindness in severe cases.
That's serious. Did it mention enlarged organs? Spleen, liver?
It did, but interestingly, it flags splenomegaly and hepatomegaly as uncommon findings specifically for Polycythemia vera.
Okay, so what actually causes this overproduction of red cells? Did the source get into that?
It points towards genetics. Specifically, a JAK2 mutation seems to be involved.
Like a faulty switch?
Kinda, yeah. It tells the bone marrow to just keep churning out red blood cells when it shouldn't be.
Okay, so given all this, the vague signs sometimes, the potential for serious issues, the genetic link, how does a vet actually, diagnose PV?
Hmm.
Especially since thick blood could mean other things.
Ah, yes. The diagnosis. The source really stresses how crucial ruling out other causes is. That's step one.
And what kinds of other causes are we talking about?
Oh, it's a long list. The differential diagnosis list is huge. Simple stuff like severe dehydration can concentrate the blood.
Okay, makes sense.
But also serious kidney issues like tumors or chronic infections, because kidneys produce the hormone that stimulates red cell production.
Right, erythropoietin.
Exactly. Then there are hormonal causes like Cushing's disease or even certain hormone treatments, and big ones like chronic heart or lung disease.
Wow, so it's a real process of elimination.
Definitely, you had to systematically rule those out.
So what are the key positive findings for PV itself, according to the source?
Well, the absolute cornerstone is a very high packed cell volume, or PCV, and tests confirming that absolute increase in total red blood cell mass we talked about.
Okay.
And usually, though not always definitively, that erythropoietin level, the hormone, is low or even zero. But the source cautions there can be overlap with other conditions there.
So it's not a perfect test on its own.
Not always a smoking gun, no. You might also see kidney value changes suggesting dehydration, or, interestingly, high white blood cell counts in maybe half the dogs.
Okay, so blood tests are key.
Yeah.
What about looking inside? Imaging.
Right. The workup is comprehensive. The source mentions chest x-rays for the heart and lungs, abdominal x-rays or ultrasound for kidneys and adrenal glands.
Looking for those other causes.
Exactly. Maybe even an echocardiogram, a heart ultrasound, to rule out specific heart defects, and potentially more involve things like a bone marrow biopsy and an ECG, that detailed eye exam, and blood pressure checks.
That sounds like a thorough investigation.
It has to be.
So once you've gone through all that and PV is confirmed, what can be done? What does the source say about treatment?
Well, for an immediate crisis, like if the blood is dangerously thick, the first step mentioned is phlebotomy.
Just removing blood.
Essentially, yes.
Yeah.
Carefully removing a calculated amount of blood to physically reduce the red cell count, combined with giving IV fluids to replace the volume and dilute things, it can provide quick relief.
Okay, that makes sense for a crisis. But what about ongoing management?
For that, the source highlights a medication called hydroxyurea.
How does that work?
It suppresses the bone marrow's production of red blood cells. It doesn't cure it, but it helps control the numbers.
Is it tricky to use?
It requires careful management. The source gives a starting dose range, but emphasizes it needs adjusting based on blood work results and watching for side effects, especially on the bone marrow itself.
Right.
And crucially, the source strongly recommends consulting a veterinary oncologist, a specialist, for the most current advice.
Okay, specialist input is key.
Mm.
And then follow-up. How do you keep track of things?
Constant vigilance, really. The source outlines the need for regular rechecks. That means periodic exams, repeated CBCs, the complete blood counts to monitor the red cells.
Makes sense.
Also, those retinal exams to check the eyes, and serum chemistry profiles to monitor organ function and potential drug side effects. It's about long-term control and monitoring.
Wow. Okay, that gives us a really clear picture from this source, from the subtle start through that complex diagnosis to the careful ongoing management of polycythemia vera.
It really does lay it out.
And for you, the listener, I think understanding these steps, the potential signs, why the diagnosis can be tricky, it's so valuable if you have an older pet. It really highlights why sometimes vets need to do a very thorough workup.
Absolutely. Being informed helps you advocate for your pet.
So pulling back, what's a final thought from this source? What should we leave our listeners thinking about?
Maybe just how interconnected everything is. You start with potentially a tiny genetic mutation in the bone marrow, and it ends up impacting blood thickness, which affects oxygen to the brain, vision, kidney function, heart strain, even how thirsty the animal is. It all ties together.
That's a great point. It shows why you really need that holistic, whole animal approach to diagnosis that the source emphasizes.
Exactly. You can't just look at one piece in
Magical.
isolation.